Welcome to today's video about symptoms of brain tumors. The brain operates with over 86 billion neurons firing every second to keep you alive. But when something goes wrong, when an unwanted growth begins disrupting this delicate system, your brain doesn't stay silent. It whispers warnings through subtle symptoms that most people dismiss as stress, aging, or bad luck. Medical research has uncovered 8 bizarre symptoms that could signal brain tumors months before the obvious signs appear. These aren't the dramatic headaches or seizures you'd expect. Instead, they're the quiet changes that make you think something feels off. Here's the unsettling truth. By the time classic symptoms appear, valuable treatment time may already be lost. But armed with the right knowledge, you could recognize these early warning signs and potentially save a life. Before we explore these hidden symptoms, if you're new here, welcome to our channel where we break down complex medical research into life-saving information. Hit that subscribe button and ring the notification bell. Your health journey deserves the latest evidence-based insights. Drop a comment telling us which country you're watching from. Building our global health community starts with knowing where you are. Today, we're diving into peer-reviewed studies from major medical journals to expose these 8 strange symptoms. Each one has been documented in real patients, backed by clinical research, and could be the key to early detection. Ready to discover what your brain might be trying to tell you? All right, here are 8 strange brain tumor symptoms you probably haven't heard of. Let's begin with number 1, sudden personality shifts. A loving parent suddenly becomes cold and indifferent. A gentle spouse turns irritable and aggressive without explanation. These dramatic personality changes aren't just relationship problems. They could be your brain's first distress signal about a growing tumor in the frontal lobe. The frontal lobe serves as your brain's CEO, controlling personality, decision-making, and social behavior. When tumors develop in this critical region, they gradually disrupt the neural pathways that make you you. Research published in Neuro-Oncology Practice has documented that personality changes often precede other recognizable brain tumor symptoms by months or years. Studies of glioma patients revealed that 20 to 35% experienced behavioral changes as their initial symptom. These weren't subtle shifts. Families reported feeling like they were losing their loved one long before any medical diagnosis was made. The most common changes included sudden loss of empathy, inappropriate social behavior, uncharacteristic aggression or passivity, and dramatic shifts in personal values. Research found that clinical levels of disinhibition were significantly higher in patients with frontal tumors compared to those with tumors elsewhere in the brain. Patients with frontal lobe involvement reported more executive dysfunction and behavioral problems than those with non-frontal tumors. The frightening aspect of this symptom lies in its gradual nature and the affected person's lack of awareness. Unlike physical pain that demands attention, personality changes creep in slowly, making family members question whether they're imagining things. What makes this particularly dangerous is how easily these changes are attributed to stress, depression, or relationship problems. If you notice persistent, unexplained personality changes in yourself or someone close to you, it warrants immediate neurological evaluation. Next, symptom 2, unexplained clumsiness. Coffee cups slip from steady hands. Simple tasks like buttoning shirts become frustratingly difficult. Walking up familiar stairs suddenly requires concentration. This isn't just getting older. It could be your brain's motor control centers crying for help as a tumor disrupts the networks responsible for coordination and balance. The cerebellum, your brain's sophisticated balance center, processes thousands of signals per second to coordinate movement and maintain spatial awareness. When tumors develop in the cerebellum or motor cortex, they interfere with these finely tuned neural networks, creating subtle but progressive coordination problems. Research documented in neurological journals shows that patients with cerebellar tumors initially experienced what they described as becoming clumsy months before their diagnosis. These patients reported dropping objects more frequently, bumping into door frames they'd navigated thousands of times, difficulty with fine motor skills like typing or writing, and a general sense of unsteadiness that seemed to worsen gradually. Studies found that motor coordination changes preceded other neurological symptoms by several months. Patients described feeling like their body wasn't responding as it should, needing to concentrate harder on movements that once felt automatic, and experiencing increasing difficulty with tasks requiring precise hand-eye coordination. The insidious nature of this symptom makes it particularly dangerous. Many patients initially sought treatment for suspected inner ear problems, arthritis, or vision issues. The gradual decline means people unconsciously adapt their behavior, compensating for decreasing abilities without recognizing the underlying cause. The key distinction lies in the progression pattern. Normal age-related changes happen gradually over years, while tumor-related clumsiness often shows noticeable decline over weeks or months. Additionally, brain tumor-related coordination problems frequently affect one side of the body more than the other. Next, symptom 3, hearing strange sounds, whispered conversations when no one is speaking, mechanical buzzing that seems to come from inside your head, music playing when all devices are off. These phantom sounds aren't signs of mental illness. They could be your brain's way of signaling that a tumor is pressing against or infiltrating your auditory processing centers. The auditory system extends far beyond your ears, involving sophisticated processing centers throughout the brain, particularly in the temporal lobe. When tumors develop in these regions, they can trigger false signals that your brain interprets as real sounds, creating auditory hallucinations that seem absolutely genuine. Research documented in neurological studies has found that temporal lobe tumors can produce various auditory phenomena. Studies of brain tumor patients found that those with temporal lobe involvement often reported hearing distinct voices having conversations, mechanical sounds like clicking or humming, musical fragments that seem to replay spontaneously, and simple sounds like buzzing or ringing. A landmark study published in the American Journal of Psychiatry analyzed 458 brain tumor cases and revealed that 96 patients experienced various types of hallucinations. Formed auditory hallucinations were predominantly related to temporal lobe lesions, though frontal and parietal areas were also involved. Unformed auditory hallucinations were related to frontal and temporal lesions, with sounds typically appearing on the side corresponding to the tumor location. The pattern of these auditory disturbances provides important diagnostic clues. Tumors near the primary auditory cortex tend to produce simple sounds like buzzing or ringing, while those affecting auditory association areas create more complex hallucinations like voices or music. What makes this symptom particularly challenging is the psychological impact and stigma. Many patients initially fear they're developing psychiatric conditions, leading to delays in seeking appropriate medical care. Next, symptom 4, vision distortions. Sudden flashes of light that look like lightning bolts across your vision, shimmering patterns that remind you of heat waves, part of your visual field disappearing as if covered by an invisible curtain. These aren't typical eye problems that glasses can fix. They're complex neurological phenomena that occur when brain tumors interfere with your visual processing centers. The visual system involves multiple brain regions that process, interpret, and integrate visual information. The occipital lobe serves as the primary visual cortex, while temporal and parietal regions handle visual memory and spatial processing. When tumors develop in these areas, they can create a stunning array of visual disturbances. Medical research has documented that visual auras, sudden flashes of light, geometric patterns, or colored shapes occur in patients with occipital lobe involvement. Case reports describe patients experiencing phosphenes, flashing white lights, fortification spectra, expanding zigzag patterns, and scintillating scotomus, areas of visual disturbance with shimmering edges. A documented case published in PMC involved a 55-year-old woman with a parieto-occipital meningioma who presented with migraine-like visual auras consisting of transient flashing white lights and expanding zigzag patterns in her left visual field. These episodes occurred for years before the tumor was discovered following a head injury. Brain tumors affecting visual pathways can cause loss of peripheral vision on one side, double vision from pressure on eye movement nerves, and visual field defects where portions of vision simply disappear. The tumor can compress optic nerves or increase pressure within the skull, affecting the optic disc. The complexity of these symptoms often leads to misdiagnosis, with patients initially treated for migraines or eye strain. However, brain tumor-related visual disturbances often affect both eyes simultaneously and may worsen over time. Next, symptom 5, sudden trouble with everyday words. You reach for a simple word like water or chair, but it vanishes from your vocabulary. You know exactly what you want to say, can see the object clearly in your mind, but the words simply won't come. This frightening experience represents one of the most subtle yet significant early warning signs of brain tumors affecting the language centers. Language processing involves sophisticated networks primarily located in the left hemisphere, including Broca's area for speech production and Wernicke's area for language comprehension. When tumors develop in the left temporal lobe or surrounding regions, they disrupt these neural pathways, causing what researchers term anomic aphasia or word-finding difficulties. Research published in neurological journals has documented this phenomenon in brain tumor patients. Studies reveal that language difficulties often appear as the initial symptom, months before patients seek medical attention. Individuals describe feeling like common words are on the tip of their tongue, but unreachable, substituting incorrect words that sound similar, struggling with names of familiar objects or people, and experiencing increasing frustration during conversations. A documented case involved a patient whose first and only symptom was anomic aphasia, difficulty finding specific words despite normal understanding and speech fluency. Brain imaging revealed a large tumor in the left temporal lobe, demonstrating how language problems can be the sole presenting symptom of significant brain pathology. The pattern of language difficulties provides clues about tumor location. Left temporal lobe tumors typically cause problems with word retrieval and naming objects, while frontal lobe involvement might affect grammar and sentence structure. Patients often maintain their ability to understand language while struggling to express themselves. What makes this symptom particularly insidious is how easily it's attributed to stress, fatigue, or normal aging. Next, symptom 6, altered sense of smell or taste. Your favorite meal suddenly tastes metallic. Fresh flowers smell like something rotting. You detect strong odors that no one else can smell. These disturbing changes in smell and taste, known medically as phantasmia and dysgeusia, can be among the earliest indicators of brain tumors affecting the olfactory and gustatory processing centers. The sense of smell connects directly to the brain through the olfactory nerve, making it uniquely vulnerable to tumor-related changes. The olfactory tract, temporal lobe, and frontal lobe all play crucial roles in processing smell and taste information. When tumors develop in these regions, they can create phantom smells, distort existing odors, or completely eliminate normal smell and taste function. Research has documented the connection between brain tumors and chemosensory changes. Studies of brain tumor patients found that a significant percentage experienced smell or taste alterations before their tumor diagnosis. These patients reported persistent metallic tastes that made eating unpleasant, phantom smells of burning or chemicals that weren't present in their environment, sudden inability to taste sweetness or detect certain odors, and food aversions that developed seemingly overnight. Documented cases include patients with olfactory groove meningiomas who presented initially with smell disturbances, and temporal lobe tumor patients who experienced both taste and smell alterations as early symptoms. The olfactory system's direct connection to the brain makes it particularly sensitive to intracranial pressure changes and tumor effects. The impact on daily life can be profound. Many patients lose weight due to decreased appetite, experience anxiety about eating situations, and struggle with depression related to losing these important senses. The psychological toll is significant as smell and taste are intimately connected to memory and emotional well-being. What makes this symptom concerning is how often these changes are dismissed as medication side effects or sinus issues. Next, symptom 7, unusual sleep disturbances. Your body's natural sleep-wake cycle suddenly goes haywire. You're wide awake at 3 a.m. despite overwhelming exhaustion during the day. You find yourself needing unexpected naps that never satisfy your fatigue. These aren't ordinary sleep problems. They could signal that a tumor is interfering with your hypothalamus, the brain's master clock. The hypothalamus, though small, serves as your body's control center for circadian rhythms, sleep cycles, and numerous hormonal processes. When tumors develop in or near this critical region, they can dramatically disrupt these carefully orchestrated biological systems, creating sleep disturbances that seem impossible to explain or treat. Research published in sleep medicine journals has documented the connection between brain tumors and sleep disruption. Studies of brain tumor patients revealed that over half experienced significant sleep pattern changes before their diagnosis. These weren't typical insomnia complaints. Patients described sleeping 14 to 16 hours per day while still feeling exhausted, complete reversal of day-night sleep patterns, sudden onset of daytime sleepiness during conversations, and finding that no amount of sleep provided genuine rest. The mechanisms behind these sleep disturbances are complex. Tumors can directly damage sleep-regulating neurons, increase intracranial pressure affecting sleep centers, disrupt production of melatonin and other sleep-related hormones, and interfere with the brain's ability to process normal sleep signals. What makes this symptom particularly challenging is that sleep problems are incredibly common and usually attributed to stress, lifestyle factors, or other medical conditions. However, tumor-related sleep disturbances have distinct characteristics. They often develop suddenly rather than gradually, don't respond to typical sleep hygiene measures or medications, and may be accompanied by other subtle neurological changes. The key lies in recognizing that persistent, unexplained changes in sleep patterns, especially sudden onset or patterns that don't improve with standard interventions, warrant neurological evaluation rather than simple sleep study referrals. Next, symptom 8, twitching or jerking. In one limb, a sudden, involuntary jerk of your hand makes you drop your coffee. Your leg develops repetitive twitching that seems to have a mind of its own. These localized muscle movements might seem like harmless quirks, but they could be manifestations of focal seizures caused by abnormal electrical activity from a brain tumor. Jacksonian seizures, named after neurologist John Hewlings Jackson, are focal seizures that begin in a specific area of the motor cortex and cause involuntary movements in corresponding body parts. When brain tumors develop in or near the motor cortex, they create abnormal electrical activity that triggers these localized seizures, often affecting just one hand, arm, leg, or side of the face. Research in epilepsy and neurosurgery journals has documented this phenomenon. Studies of brain tumor patients found that focal motor seizures were a common presenting symptom. These patients described rhythmic jerking or twitching that typically lasted 30 seconds to 2 minutes, movements following predictable patterns, often starting in fingers and potentially spreading up the arm, retained consciousness during episodes, and increasing frequency over weeks or months. The anatomical relationship between tumor location and affected body parts provides valuable diagnostic information. Tumors in brain areas controlling hand movement cause finger and hand twitching, while those affecting leg control areas cause foot and leg movements. This precise correlation reflects the organized structure of the motor cortex. What makes this symptom particularly dangerous is how easily isolated twitching is dismissed as muscle fatigue, stress, caffeine effects, or benign fasciculations. Many patients don't seek medical attention until seizures become more frequent or obvious. However, focal seizures can be the earliest sign of brain tumor activity, and recognition could lead to diagnosis months before other symptoms develop. The progression pattern is typically predictable. Seizures often increase in frequency and duration over time, may begin to involve larger areas of the body, and can eventually generalize into full convulsions if left untreated. Your brain is an extraordinary organ containing 86 billion neurons, working in perfect harmony to control every aspect of your existence. When that harmony is disrupted by tumor growth, your brain attempts to communicate the problem through subtle changes that are easy to miss but crucial to recognize. The 8 symptoms we've explored: sudden personality shifts, unexplained clumsiness, hearing strange sounds, vision distortions, trouble with everyday words, altered smell or taste, unusual sleep disturbances, and localized twitching, represent your brain's early warning system. What makes these symptoms particularly important is that they often appear months before the more obvious signs that typically prompt immediate medical attention. This window of opportunity could be life-changing. Early detection of brain tumors significantly improves treatment outcomes and quality of life. The research we've discussed comes from peer-reviewed medical journals and represents the experiences of thousands of patients who wished they had recognized these signs sooner. The key message isn't to panic about every minor symptom, but to develop awareness of persistent, unexplained changes in your neurological function. Trust your instincts. You know your body better than anyone else. If you notice gradual changes in personality, coordination, sensory perception, or cognitive abilities that can't be explained by obvious causes, don't hesitate to seek medical evaluation. Knowledge saves lives. Share this information with your family and friends. It could make the difference between early detection and missed opportunities. If you found this video informative and helpful, please type helpful in the comments below. Your engagement motivates us to continue producing evidence-based content that could make a real difference in people's lives. Don't forget to give this video a thumbs up if it provided valuable insights, share it with anyone who might benefit from this information, and subscribe to our channel for more health content based on legitimate medical research. Thank you for taking the time to educate yourself about these important health topics. Your proactive approach to health awareness could be the key to early detection and successful treatment.